Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning has been on your health. Cancer is currently the leading cause of death in Wisconsin. Approximately 30,000 Wisconsin residents are diagnosed with cancer each year, and more than 11,000 die from cancer. My next guest works as the health systems manager for the American Cancer Society. Happy to welcome Mrs. Jennifer Washington-McMurray. How are you, Jennifer?
Hello, I'm fine, thank you.
Thank you for being here.
Thank you for having me. Absolutely.
And of course, we want you to start off and talk a little bit more about the American Cancer Society and what it is you do.
The American Cancer Society is a global organization. And one thing about American Cancer Society is that we're all about saving lives, celebrating more birthdays. We've been around for over 100 years. And often asked, what's the difference between American Cancer Society and all of the other organizations that are out here doing fantastic work about cancer awareness and education, is that American Cancer Society covers all cancers. Right. And every cancer has a different treatment. So as discussed previously, whether it's lung cancer, colon cancer, pancreatic cancer, we cover all cancers and not just breast cancer, which is very important.
Yeah, and I was looking at your website and you're able to actually maneuver through and
Isn't
look
it
at
fantastic?
the different at the different types of cancer that exist. And I mean, I had no idea that many cancers actually were even in existence.
Absolutely,
honestly.
absolutely.
It had to be over 50.
Over 50. I mean, I work for the organization, and I'm often amazed, and I'm so very happy that you brought up the website. I really encourage your viewers to go to our website and, you know, take a look around. As you said, it's very easy to go through it, and it answers questions about the different cancers, different diagnosis, screenings, just a lot of information that's so helpful. So yes, go to cancer.org.
Yeah, and the thing is when people are diagnosed, they have a lot of questions and they're not always able to think of everything in that one visit that they may have, you know, with their doctor. So when you look at your website, it answers every question that has to do with cancer, what radiation is and the difference between radiation and chemotherapy and all of these different things. So whether someone's diagnosed or they know someone that has been, it's very helpful in being able to answer questions and really be there for an individual who is battling.
Absolutely, and it really doesn't even matter how much you feel you may know about cancer. When you're actually in that position, either as being the patient that was diagnosed or a caregiver for a loved one, you need help.
Yeah.
You need help. About 3 years ago, my mom passed away from pancreatic cancer, and I needed help. And therefore, it was just wonderful to be able to go to our resources that are available. So yes, use our website.
Yes, and Jennifer, out of all Wisconsin counties, some of the highest cancer incidence and mortality rates are found in southeastern Wisconsin, and African Americans and Hispanics and American Indians have the greatest disparities.
Yes.
I talked a little bit with Dr. Izzard in the last segment about why that is, but it really is intriguing when you look at a lot of different minority and ethnic groups. They deal with health disparities more than anybody else.
Anyone else, and it's not because they're African American or Native American or Hispanic and Latinos. That's not the reason. It's because we get screened too late. And I mean, the best detection is early.
Right.
I mean, the best prevention is early detection. Get your screenings done, but we don't do that. And so as Dr. Izzard mentioned, there's more than one reason why, but I have to really just emphasize it's because of a lack of communication. We don't want to talk about it in our families. And every ethnic group has different barriers, but it leads back to communication. I believe D-Rock mentioned that, well, he wasn't like, the communication was between his parents, right? Okay, but what about the children? right? And we need to know our family history because when we go in and we meet with our doctors, those are the questions they're going to ask us, and it's going to determine when we should start our screenings. So we need to communicate, we need to talk about it, and we need to change our lifestyles.
Absolutely. And changing your lifestyle, meaning the way we eat, getting a little exercise here and there.
Right.
And sometimes people, it's hard. Change is hard in no matter how you look at it. But when you talk about looking at the number of years that you may be on this earth, it's worth taking the chance and at least exploring what changes you can make when it comes to your diet and especially exercise. You can turn on the radio and dance, and that's exercise.
Absolutely. And small changes equal big results. I always say that. And as you said, everyone has room for improvement. But unfortunately, you know, within the African American community and the Hispanic Latino communities, we eat a lot of fatty food, a lot of salty food, and we think we should eat it all the time. And that's where we need to make some changes and stuff. Instead of having so much beef and pork, use turkey and chicken and fish. Those are excellent, and more fruit and vegetables, and laying off the bread and the macaroni and cheese and everything. But I do not have a recipe for low-calorie macaroni and cheese. Just make it
Patty
the
LaBelle
way,
does.
you know, Patty does. Patty does. But you know what? If you don't have a recipe like Patty for low-fat mac and cheese, just don't have it often. Just because it's Sunday don't mean you have to have macaroni and cheese. Save it for the holidays, right?
And I'm guilty because what I do, I don't necessarily get in the kitchen all like that, but I eat out all the time, and eating out all the time is just as bad as, you know what I mean?
Yes, it
like
is.
a lot of stuff is processed, and so I have to, you know, be aware too, just because I'm busy and, you know, you get home late and you just want a quick meal.
And take time to look even at the menus at some of the fast food restaurants. There are choices out there that you can make that's more salads, more parfaits, yogurt, things like that. Make healthier, but it takes time to plan. That's another thing that we have to just plan in our day.
Well, I do want to talk about the American Cancer Society being a partner with the Milwaukee Health Services Incorporated for this Laughter for the Soul, Chuckles for Your Health event. And if somebody's just tuning in, this event is going to be featuring Cedric the Entertainer and a lot of funny local comedians and entertainment, and I'm really interested in finding out why it's important for you guys to partner with organizations like this to help spread awareness.
We are so excited about the work that MHSI is doing here in Milwaukee, as well as Isaac Cox. They are able to reach an audience that and a community that really needs a patient medical home that can cover all of their issues, okay? It may not necessarily be that they're going in for their annuals, but once they're there, they can capture, you know, the patients and then address other things by saying, oh, look, you're 50 years old, it's time for, you know, your colon cancer screenings, and these are the options that, you know, we have available, and people have options. That's another thing. So we are very excited about the work that MHSI is doing, and we've been partners with them for a very long time. And when you hear the word cancer, you know, people don't want to talk about it. Okay? Matter of fact, people don't want to talk about anything that has to do.
Think about it.
Don't want to think about cancer. See the C word? No, they think they can get cancer by seeing cancer or any other health, you know, situation. So to be able to just like give it a different face and laugh about it is another way to approach a very important topic. Sometimes you have to be very innovative and clever to get the education and the information out to our patient and our communities. So that's one thing that, you know, we're excited about partnering with MHSI about this exciting event.
Yeah, and you both do a great job of doing just that, because I know that earlier in the year you had a big health fair and you attended attached
yes.
some big names to it that really was attractive to individuals to get them there, and then once they're there, they get that information.
That's the plan.
So yeah,
that's the plan to get them there. You're speaking of our Sankofa Health Fair that we hold every year at the end of April. This year we brought Dorinda Clark Cole. Last year we brought Regina Bell, and we're going to continue to do that great work. And that's held over at North Division High School, and it's targeting mostly the African American community. Everyone is welcome. But then later in June, we have another health fair that's called DIA, and that's held on the south side at South Division High School, where we have a large Hispanic Latino community there, and we have interpreters. It's just a fantastic event, but yet using creative ways to get the education and information out to those individuals. Unfortunately, when you say, I'm having a health fair, come, people are not really interested, so you have to add some other creative things in there.
All right, good stuff. Thank you so much for stopping by and giving us all the great information. Jennifer Washington-McMurray is the Health Systems Manager for the American Cancer Society. For more information on anything we've discussed, you can log on to cancer.org, and also keep in mind that September is Ovarian Cancer Awareness Month, and you can also give them a call at 1-800-227-2345. That's going to do it for today's show. I'm your host, Andrea Williams. As always, thank you for watching, and I do hope you join us again next week as we take another look at our issues, Milwaukee. Have a great day.